Joining me now is Lynn Barr, founder of Caravan Health. Lynn, thank you so much for joining me.
Thank you so much for having me on the show.
I'm really grateful you're here. It's a really important conversation we're going to have. The government shutdown showdown we saw in October and November was all about healthcare costs in this country, specifically the enhanced Obamacare subsidies that are set to expire at the end of this year. And if they do in fact lapse, over 20 million Americans will see their premiums skyrocket. Senate Democrats and Republicans had different plans to address healthcare costs and had a vote on dueling bills. Neither plan passed, though. We will look at both proposals. But to start off the conversation, what are your thoughts on the impasse we really seem to be at as an entire country when it comes to really high healthcare costs?
Well, it's not really a partisan problem. I mean, the cost per capita in the United States is more than 2.5 times the other developed nations in this country. It is a bigger problem than this. We're trying to play whack-a-mole with, trying to help this sector and this sector and this sector, but every American is being punished by our costs that are completely out of control, that are paired with outcomes that are part of the lowest in the OECD countries.
And if you talk to anyone, they'll tell you a time probably where an unexpected health incident, either related to themselves or to a family member, almost bankrupted them. And the fear that people have when they say, I can't really afford any type of health disaster right now is staggering, especially being in the United States. I know you said that this is going to impact every place in America, but specifically, where are you going to see the impacts the most in this country?
You bring up a great point, Lindsay. I mean, the cost of healthcare is causing bankruptcy in the United States. So it's the number one cause of bankruptcy in the United States, and that goes across the board. So this isn't just, any small sector. That's all across the country, and over 62% of bankruptcies are caused by healthcare costs. So, how do we stop this whole train from moving forward? And if you look at the average cost per year per capita in the developed nations of being between $5,000 and $6,000 a year, and we're paying more than $15,000 a year per person, that's about $3 trillion more than the rest of the world, right? And per year, every year. And so, we play whack-a-mole and we're like, oh, let's try to help these people and try to help these people. We have to fix a bigger problem, because no matter what we try to do, and I definitely don't want people to lose their insurance, but everyone could have insurance if we just brought down the costs, and we're not actively succeeding in any of those initiatives.